So we're going to talk tonight about the risk of fetal harm with letrozole in fertility treatment. So basic background behind this is that letrozole is a medication that was initially used to reduce estrogen levels, mainly for breast cancer protection and treatment after women, especially young women, had had breast cancer. Dr. Bob Casper and Mohammed Mitwali pioneered its use in women to try and see if it could make them ovulate, and found out that it could, and then it became kind of more and more used for patients who had polycystic ovarian syndrome. So several years ago, back in I think 2008, a Canadian group from Montreal said maybe it is causing fetal malformations, and conducted a study where they showed that there was about a 4.7% risk of fetal anomalies with letrozole versus just a 0.8% in the control group. And the problem was their control group was just regular patients with no fertility history. And that's not really a valid control group, because we do know that infertility patients have a higher chance of anomalies. So this study actually took all of the studies available on letrozole, pooled all of the ones that were valid, and then analyzed them to see if there was actually a risk. So that's what we're going to be discussing tonight, and I want to go through that. So this is coming out. Its new article has not yet been published. It's coming out in Human Reproduction Update. The name of the lead author is Jyotsna Pundir, P-U-N-D-I-R. And again, it says yet unpublished. So what they did was they analyzed all of the studies out there that evaluated the use of letrozole in comparison to any other drug or placebo, and had information on fetal outcomes. And there were 888 articles that they started with. They narrowed it down to 893. They wanted full text articles, so that dropped it dramatically down to 227. And then they had to exclude quite a number for problems with the articles. So they ended up actually at the end of it all with 46 studies that they felt met their inclusion criteria. And in the quantitative part of the meta-analysis, there were 39, 18 were in randomized controlled trials, 21 were in cohort studies. So still a lot of data in there, lots of trials, lots of data, and so a good job overall in terms of what the numbers were. So the first thing that they looked at was comparing clomiphene use to letrozole. So is there a difference if you took Clomid versus letrozole? Because now you're kind of doing an apples to apples comparison with most likely women who the majority of them would have had polycystic ovarian syndrome, maybe sometimes unexplained infertility, although neither of those drugs work alone for unexplained infertility. And there were quite a number of studies, both in randomized controlled trials and in cohort studies, and neither of those groups showed any difference in terms of the risk with letrozole use. So compared to Clomid, there's absolutely no statistically significant increase or decrease. And in fact, not a single one of the studies that they included showed any difference whatsoever. And so there was eventually no difference in the randomized controlled trials. When you look at the cohort studies, which are not as valid, but still they tend to be bigger with greater numbers of patients, there were two studies that just barely met significance for showing actually a decrease in risk in letrozole compared to Clomid, but overall they said that there was no statistically significant difference. So we know that letrozole is a better medication to use for PCOS, and so in this particular sort of evaluation, it's demonstrating that there's actually no significant difference. You can use either one and you're going to get the exact same result. And that's from a safety perspective. From a pregnancy perspective, letrozole has a 27.5% live birth rate after 6 months of use, whereas Clomid has a 19.1% success rate for live birth. So letrozole is more potent in terms of pregnancy, but it has the same exact side effect profile in terms of fetal risk. So then they compared the letrozole use to just natural conception. So these are infertility patients, but who are trying naturally. And again, they showed absolutely no difference. And this was actually a randomized controlled trial. And then in the two cohort studies that they looked at, Again, there was absolutely no difference, although one study did show that there was a lower chance of an anomaly with letrozole, but nevertheless they said overall there is no statistically significant increase or decrease in letrozole compared to patients that are not taking any medication, which isn't quite placebo, but is close. The next group was looking at the injectable medication. So what if you need the injections for your fertility therapy? And again, they showed absolutely no difference in the two randomized controlled trials. There were 6 different cohort studies, and all of them lined up almost exactly on the center line, meaning that there is no difference again between injectable meds and using letrozole. So either way, you're going to get the same risk of fetal abnormalities. And keep in mind that the background rate of fetal abnormalities in fertility, without fertility, is about 2 to 3%, and it's typically up a tiny bit when fertility is part of the problem. So then they also looked at comparing natural cycle assisted reproductive technology. So this would be IUI or IVF, and they wanted to compare that to the patients that were taking letrozole. And again, they showed absolutely no difference. So these authors basically said, look, there's no difference in the chance that the infants are going to be born with any abnormalities. It's the same outcome. Letrozole does not appear to pose any significant risk. But then they went into it a little bit further and said, well, what if we look at things like live birth and pregnancy loss and things like that? So when they assessed those, they showed that for pregnancy loss, there was maybe a slight decrease when you're using letrozole. And same thing for live birth, a very, very small increase when you're using letrozole. And so good results overall when they compared it to Clomid. So they're actually saying that your pregnancy loss may be a little bit lower, equivocal because the randomized controlled trials didn't show it, but the cohort studies did. And then for the live birth, they're saying it's a smidgen higher, which we already knew, so this is further data supporting that. So if you're comparing letrozole to Clomid, it looks like your chances are better of continuing to be pregnant and getting pregnant. And they looked at the major malformations and saw that there was no difference in risk. When they compared letrozole to the injectable medications, they saw absolutely no difference for pregnancy loss or for major malformations. And then when they compared it to natural conception, they looked at major malformations, and again, as I mentioned before, there was no significant difference. And when they looked at pregnancy loss, there was also no significant difference. So taking letrozole versus natural, it actually looks like you have the exact same outcome as far as miscarriage risk is concerned. They then also looked at natural cycle assisted reproductive technology, again, whether it was IVF or IUI, versus the letrozole. And there were one study that was included there which did look at that. And in that study, they actually showed a 10% decrease in miscarriage rates when you're using the letrozole. Now, many of you hopefully have watched our previous episodes where we use letrozole as part of our frozen embryo transfer protocol now, because there are lots of studies supporting the use of that. And so we've built it into our program, and the pregnancy loss hopefully is going to be lower with that, because that seems to be part of what we're seeing in these studies as well. So overall, it appears that number one, letrozole is effective. Number two, it's potentially more effective than Clomid, and that's being borne out in both this study and a previous very well done randomized controlled trial that was published in the New England Journal by a gentleman by the name of Legro, L-E-G-R-O. And that's where that 29 versus 19% comes from that I quoted earlier. And then on top of that, the chances of miscarriage appear to be a bit lower as well. Are there increased risks of malformations? No, there definitely does not appear to be any increased risk of malformations when you're comparing letrozole to any other fertility treatment that is available. So whether you're using natural, whether you're using Clomid, whether you're using injectables, or even natural with assisted reproductive techniques like IVF or IUI, you're going to get the same outcome, which is great news, because Letrozole is now recommended as the first-line therapy for PCOS patients, and we certainly don't want any of you to take something that isn't safe. We want you always to take medications that are safe, are going to result in a positive outcome for you, and result in a safe outcome for you as well. So is it a fact or a fiction that letrozole causes fetal malformations? It is a fiction. There is no evidence supporting the concept that letrozole actually increases your risks of fetal malformations when you use the correct control group, which are other patients with infertility or other patients who are suffering from infertility and or undergoing treatment. So make sure you like, comment, and subscribe. We always want to see how you guys feel about this. Let us know your experiences. If you've used letrozole, did you have any children with any complications? Certainly share with us all so that we can bring that to the rest of the group and the rest of the community and make sure they know about what happened to you. And we want to hear from you about what you thought of this video. So let us know. Just click on that subscribe button and we'll be happy to bring you on board.